Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I will be your facilitator for today's session. Today we're going to be talking about the safe use of medications for seniors and caregivers. And we have Lucy Barylak with us today. Welcome, Lucy.
Thank you.
Let me tell you just a little bit about Lucy if you have not heard her presentations before. Lucy has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She has been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and clinics in Texas. And Lucy would also like you to know that she was a caregiver for her mother for about 10 years. Lucy, if you want to get started, I know you have a lot of information to share with us today.
I do. Thank you so much. Good morning, everybody, and welcome to our session today. I just wanted to say that the guide was published by the WellMed Charitable Foundation and edited by myself. Our second session is on Wednesday, October the 6th at the same time. And I think it's important, it would be advisable for you to attend both sessions because there are different topics that I will be discussing. So if you are interested, you will be receiving the guide by mail if you have formally registered for this session, and we'll talk a little bit more about that later on. What I do want to tell you is, yes, I'm a social worker, I'm a researcher, I develop all kinds of services for caregivers, but I'm not a doctor, I'm not a pharmacist. However, I have researched this topic and I'm following the recommendations of research studies as well as the guide itself. So my last slide, I'm going to have references. There's many references that are there, articles that you could also read, which are very easy to as well. But what I want to say to you is information is powerful. When you have information about certain things, you have a lot of more control about what's happening in your lives as a caregiver and how to care for your loved one. Next slide, please. I'm going to be speaking today about what are medications, what can be the adverse side effects of medication, how can medication interact differently in older adults, and it certainly does. Some common mistakes when using medications, the importance of following routine when taking medications. Now, I want to share a very interesting article with you. It's by Family Caregivers Allowance, has a wonderful article, and it's called Medications, a Double-Edged Sword. So basically what they're saying is that modern medicine has contributed to a large lifespan, improved health, and better quality of life. Medications are the most common treatments of many diseases and conditions seen in older adults and persons with disability. Medications now not only treat and are cure disease that were, untreatable just a few years ago. They aid in the early diagnosis of the disease, prevent life-threatening illnesses, relieve pain and suffering, and allow people with terminal illness to live more comfortably during their last days. However, for older adults and people with disabilities, medication, prescription, over-the-counter, social drugs such as alcohol, herbal medications can be a double-edged sword when not used appropriately, effectively, and safely. Medications can have devastating consequences. The changes that occur with aging and disability make people more likely to suffer medication-related problems, which are called MRP. Nevertheless, researchers have shown that medication-related problems are often preventable. Caregivers can play a key role in helping to identify when or potential MRPs is occurring. This assistance can help prevent the costly and unwarranted negative consequences of medication use, such as admissions to acute care hospitals, assisted living facilities, or nursing home. About 1/4 of all nursing home admissions are due to, at least in part, to the inability to take medications correctly. So that is a reality check. Now, I want to sort of share some other information with you from the research. Unfortunately, medication mistakes cause at least one death every day in this country and injures regularly 1.3 million every year, according to the US Food and Drug Administration. People aged 65 and older are especially vulnerable to medical errors for different reasons. So caregivers, you play a vital role in keeping seniors healthy by familiarizing yourself with the most common medications errors. Now, there's, according to the CDC, Center for Disease Control and Prevention, report November 2020, older adults 65 years or older visit emergency departments almost 450,000 times each year, more than twice as often as younger persons. Older adults are nearly 7 times more likely than younger persons to be hospitalized after an emergency visit, but most of these hospitalizations are really due to medication problems and side effects. It's really very important to be very wary of that, especially certain medications like blood thinners, diabetic medication, seizure medication, opioids are some of the medications that you really need to be very, very careful with. So what they are actually saying is we need to keep in mind that medicine, either prescribed or over the counter, has the potential to improve health and well-being. Many people, including older adults, depend on medicine to provide relief, control the medical condition, and help them heal normal, to just feel normal, active, or independent. But when not taken properly, it can sometimes cause other health-related problems. So I'm going to share a lot of this a little bit more and go in detail with you. But before we go any further, are there any questions about what I'm saying up to now?
All you have to do is unmute your microphone and I'll call on you by name if you have questions or comments. The chat box is open. You can always put your questions or comments in there and we will talk about them when we take breaks like this. But you are welcome to join us in the conversation.
Thank you for that. So let me share some more research and statistics. The safe and responsible use of medicine is important for everyone, but it is a particular concern for seniors. American seniors take more medication than any other segment of the population. While seniors make up only 16% of the population, they receive between 28 to 40% of all medication prescribed. Some seniors take as many as 9 different pills a day, several times a day. So you could just imagine what that can do. Because of the increase in the incidence of chronic or acute illness with age, older adults are more likely to suffer from conditions that need drug treatment. At the same time, the physiological changes that accompany aging increases senior sensitivity to medication. So many seniors are also taking several kinds of prescription and non-prescription medication at the same time. As a result, they are exposed to the risk of adverse reactions from unnecessary or inappropriate treatment and the misuse of medication. One study showed that older adults had an average of 3 drug-related problems. So in reality, many caregivers may find themselves helping with administrating or managing multiple drug therapists, filling and picking up prescriptions, and monitoring the schedule. Caregivers are often, they often see the result of any side effect and must react accordingly, calling the doctor or the pharmacist. I want to tell you that many times caregivers, you see all these advertisements on TV about new medication and how it can help you, and then tons of side effects, right? It's pretty scary. But what I want to tell you is they have to say that in order to make sure that even if a very slight percentage of the population is affected, it's important for you to know. But what I'm saying, it's interesting because seniors, especially, I'm going to talk about how medication actually interacts in the body of seniors. The other thing that's interesting to know that during the height of the pandemic, emergency room, we're seeing concerning numbers of patients who feared going to the emergency for many reasons, obviously. But what I do want to say now, please don't hesitate to go to the hospital if you or your loved one need urgent medical care. One of the things that I truly believe in.
Lucy,
Yes?
can I interrupt for just a moment? We're having questions about the slides. Do you have slides that are relating to what you're talking about?
Yes.
Minerva need to advance them. You haven't said that, and so I thought I would interrupt.
Yes, we do have slides.
So you want her to go ahead and advance the slides then?
Not at this point yet. Let me
Okay.
just get to a certain point. Yes, there are slides.
Thank you.
You're very welcome. I want to tell you that one of the things that I work a lot with is prevention. I totally believe in prevention. Is the key factor when using any form of medication. You need to know all the facts, the risks, the reactions, the side effects. I want to say that your pharmacist can be your best resource. Or caregivers, you are the advocates for your loved one. And so don't ever hesitate to speak to your pharmacist. What I also want to take note is that certain medication can also boost someone's sex drive or cause aggressive behavior, especially for someone who is suffering from dementia. So please remember that if a loved one all of a sudden starts behaving inappropriately in different ways, it's time to call the doctor. Explain to the doctor what's going on, because in the reality, what's happening is that they might be having a reaction to a medication, or they may have an infection that you're not aware of. And it's important for the doctor to be aware of that, to go over the medications. It's a very good idea to not continue taking medications forever without having the doctor at least review it every 6 months and the most every year. All right, so let me tell you about the guide. Let me show you the guide. This is what the guide looks like. I will be sharing a little bit more information about it a little bit later on. The safe use medication is a guide. It's a very good tool to have on hand. A lot of questions that you may or have experienced are in the guide with corresponding answers to your questions. But remember, it's only a guide that will give you some answers as well as guidance to report any issues to the doctor or pharmacist. No matter what, if you have any concerns about medication, please always call the doctor or the pharmacist. All right, next slide. We're getting to the slides now. So let's look at that. What are medications? Some of you know it's prescribed medications, over-the-counter medications, natural products or herbal medications, vitamins. Medicine can come in the form of tablets, capsules, pills, liquids, puffers, inhalers, creams, patches, drops, needles, suppositories, and ointments. And just remember that when you're putting a cream on for your aches and pains, it is going through your bloodstream and it is interacting with other medications as well. What I want to say is before buying any over-the-counter medications, please speak to the pharmacist as soon as possible. Some over-the-counter medication can have an adverse reaction to the prescribed medication you're on. Like, for example, if you have a cold and you go and get cold medication, it will increase the blood pressure for people who are suffering from high blood pressure. I'm one of those people, so if I need to do that, I always speak to my pharmacist first. As well as you can over-medicate on over-the-counter medications as well, especially sleeping pills that you can buy and pain pills as well. So please, whenever you're going to pick up any of these, the same thing goes for vitamins. It could be herbal medication because you'd never know what's in them. Next slide, please. All right, so drugs, there's always a brand name, the product name of a drug, its manufactured name. Note that some drugs have multiple brand names. Generic name is the chemical name of the drug. Every drug has a brand name and a generic name. For example, the brand name is Advil, the generic name is ibuprofen. And many pharmacists, this is what back in Canada, I think it's the same in the United States, that the generic brand could be a little bit cheaper. So it's something that you want to ask questions about. Are there any questions at this point?
You can put something in the chat box or just unmute your microphone and I will call on you by name. Sorry about that interruption about the slides, Lucy.
No problem. I'm not as savvy as Elliot is when making slides, so I apologize.
All right, I don't see that anyone has their phone unmuted, so please go ahead.
Okay, perfect. So let's just put the next slide on. This is very important. All right. You know, medication dose as well as information about effectiveness and side effects of medication are generally determined by studies done in relatively young, healthy people. I was very surprised to find that out, you know, that most of them. So this information may not apply to older adults because our bodies and how we process medication change with age. As we get older, our bodies react to drugs differently than when we were younger. The aging process, along with medical conditions, often impacts the benefit and side effects of medication. So let me talk a little bit more about what happens due to our complex journey that medications goes through our bodies from the time we take our medication until they leave our body. The aging process has affected how the medication is absorbed. That's a big one. Used in the body and exits the body. You know, changes that decrease your body's ability to break down or remove certain medications from your system may mean that medications can stay in your body longer. Now, that's important to keep in mind. So you may need a lower dose of medication or a different medication that is safer. In most cases, older adults need lower doses of medications than younger adults. You can start with a low dose of medication, then slowly increase to the target amount to receive the same benefit and avoid side effects. This can be done by working closely with your healthcare provider. Do not do this on your own for sure, okay? Now, studies also show that certain medications are less safe for older people, and it's important that you work with your provider or pharmacist to use medications that are safe for your age. Now, this is important. The American Geriatric Society's BEERS, BEERS criteria lists medication that may not be safe in older people and can be used as a tool when talking with your provider or pharmacist about using safe medication. So what I mean by that, you can actually go and download the American Geriatric Society BEERS, BERS criteria, and there's a whole list of medications there. And it's interesting, you might want to go through it yourself, and maybe you or your loved one are on that medication, and that will be a good idea to then call the doctor and discuss it again with him or her. When taking medications, it's important to make sure that the correct medication is prescribed for the correct condition, that medication is right for you, your age, and your condition, that you take the proper dose for the length of time your healthcare provider said. Next slide, please. Okay, now this is really, really important. You have to follow routine and finish medicines. Even if the person feels better, it's important to finish all the medicine, or the sickness could occur again, especially with antibiotics. I know that many times I've taken antibiotics, after a couple of days, you feel better. It doesn't mean that the infection is gone. Some medicine must be taken at certain times in order to ensure the correct amount is in the body and that it works as long as possible. The other thing that I'm sure a lot of you are doing, always carry a list of medication when you go out either for yourself or with your loved one. And always have a list of all the medications on the fridge or somewhere easy that if you have to call 911, everything is there and they know what they have to deal with. Are there any questions at this time or any comments? Okay, so let's go to the next slide, please. Not sharing, big one. It's really important not to share your medication. The medicine is for that person, and if you're sharing the medication, that person may not have enough, and you might not, you might get sick from that. Let me tell you a personal story that happened to my mother. My mother had many medical problems, some cognitive issues in later life. And what happened was she had a lot of back pain. We didn't know that her very good neighbor, her friend, was prescribed a new medication by her doctor for her pain and decided to share it with my mother. My mother landed up in hospital. And for the longest time, we really didn't know what was happening. We finally found out that she had taken this medication. And I have to say, she did get better, but it was really extremely frightening because her symptoms were so different than what she was actually facing on a daily basis. So let's go to the next slide, please. So the guide is a wonderful way to answer some of your questions because the way it works is there are questions on one side and answers and idea on the other side. So there's some common mistakes with medicine, taking the wrong dose or amount. As I said, not finishing the medication, using medication that is expired or has been discontinued. That's a big no-no. And for some people, it's difficult because sometimes medications are expensive. But if you have expired or discontinued medication, please do not throw them into the garbage or flush them down the toilet. Try and bring them back to the pharmacy. It's really not good for our environment. And obviously not sharing medication, mixing medication with alcohol. Now, a lot of caregivers have asked when we have these sessions, can we never have a drink of nice wine or once in a while? This is something you should be speaking with the pharmacist about. They really know and they will advise you of whether once in a while you can have a glass of wine. And again, forgetting to take your medication on time, not sharing, not taking medication, continue starting and stopping. Please don't do that. If things are not going well, if you feel that things are happening, call the doctor and call the pharmacist. Is there something on the chat, Glenda?
Yes, there is, and it's a really interesting question, I believe. Sharon asked, are there any suggestions how to work with a senior who takes questionable supplements purchased on the internet and this person won't stop buying them?
Oh my gosh, that's a real loaded question. Is this person competent, may I ask? Are they suffering from any form of dementia or are they totally competent?
She says somewhat, so there is some impairment there.
I know this is extremely difficult, because when someone is not declared incompetent, it's very hard to deal with that. But maybe if you could share some of the information that maybe you could watch the podcast later on and so explain to the person how dangerous that is, because a lot of these vitamins are not regulated many times, especially if you're buying it out of the country. It's very dangerous for seniors. So I think if you could sort of really speak to that person, not reprimand in any way, but just give that person information and share that information. And as I said, maybe you could share this podcast at a later date and watch it together.
We also had another one, Lucy. Diane says that her town has excuse me, a community medication drop-off at their police station, and to check with your local community to see how the safest way to dispose of meds is. And, when you were talking about that, when I was taking care of my husband as a caregiver, some years ago, there was no place to drop off those used medications. But I noticed now at my local pharmacy, they have a drop box. And so that's real progress.
That's wonderful. Yes. It's so important. And, you know, with what we're talking about, what's going in our atmosphere now and global warming, all these things are so, you know, it's so important not to flush our prescription down the toilet or in the garbage. It's just, it's so very important to keep them or take them and drop them off and bring them back to the pharmacy. I really want to thank you for those tips. That's very important. Is there any other questions?
I don't see any at this time.
Okay, so let's continue. We're going to have lots of time later on to talk a little bit more openly. All right, I know these are some common problems with medicine, okay? No, the next one, please.
Well, Diane, oh yeah, Diane said she's a nurse and laughed out loud. So she was sharing that good information with us. Thank you.
Thank you. Now, I have to say that I experienced a lot of this with my own mother when she was still, she was still alert and oriented to be able to take her medications at that time. There came a time when she wasn't, but, you know, one of the things is that there are difficulties with opening lids on medicine containers or blisters. I have to tell you that really, if you call your pharmacist, there's so many ways of adjusting that. It could be a med box, rather if it's hard to open blister packs, whatever it is. Now, the other thing that's really interesting is that sometimes it's hard for me to even read the instructions on a very small little medicine container. But my mother had that, and believe it or not, they did it in such a way, they made it much bigger for her in a bigger bottle, and it was in dark, so she was able to really look at it and be able to read it. Now, the other thing that's sometimes very confusing, is hard, is the whole notion of how many times a day, 3 times a day, as necessary, what does it mean? This is where your pharmacist comes to play. I mean, you really need to speak to them if there's a difficulty in the scheduling and things like that. Now, pills that are hard to swallow, that's a big one for a lot of people. Let me tell you something. Please do not cut the pills yourself. Do not dissolve the pills on your own. Some pills should not be dissolved. Some pills should not be cut by you, because you might not cut them equally. If you need the pills to be cut, call your pharmacist. They will cut it for you, and they will help you in dealing with pills that are too hard to swallow. Now, the other thing that could be is that inconvenient times to take the medicine. This happens. This is another thing that your pharmacist can really help you with, is to organize it in such a way that it's convenient for you and for your loved one. I want to talk a little bit of expensive cost of medication. Sometimes caregivers tell me that, you know, I either put food on the table or I buy my medication, or, you know, it's very important not to be able to take your medication properly. Now, I'm wondering, Glenda, we could do it now, or maybe we could do it later. I know that back home, there are organizations and community centers that will help people who cannot afford their medication. Is there something that you can share with us, Glenda, on that topic?
Well, let me put my video back on here. When I was the director of the Area Agency on Aging, we offered some medication assistance programs. And so and that's been some years. So let me just say that was a caveat. But what I would encourage you to do is to check with your local Area Agency on Aging. And if you're not connected with them, that's a wonderful resource for caregivers. And I would encourage you to make that connection. Whether it's about medication, whether it's about respite, there's so many things that they can help with if you are a caregiver. You can call your local 211, and that's information referral, and ask for that number so that you can connect. You can also go onto the website for the National Information or Referral Service, which is called the Elder Care Locator. and I will send out or post in the chat box that address also. So there is help out there. And you just have to reach out and look for it and ask for that assistance.
Thank you, Glenda. Does anybody else have any ideas of how to get medication if you cannot afford it?
I don't see anybody
Okay.
open their mic, but we did have a question that kind of went with what you were talking about in cutting pills, etc., Lucy. So Leonard had asked, how much water should a person take with their meds? The memory care facility only gives 1 ounce Dixie cup with 3 to 4 meds, and that causes his wife to have difficulty swallowing. I think more, not less water should be used. Do you have anything on that?
Absolutely. I mean, yes, I would think that when you take your medication, you should drink at least a full glass of water. I'm just questioning, why would they just give such a little amount of water? Have you spoken to the head nurse, or what is the reason behind it?
If you just unmute your phone, Leonard, we can hear you, and
Yes,
you and
okay.
Lucy can discuss
Can you hear
it.
me now?
Yes.
Yes, we can hear you.
Yes, I think for most of the folks, it might be a bladder incontinence issue. They don't want them drinking a lot of water because then they might have bladder issues, especially at night, but even all throughout the day. They really limit the amount of water taken with the pills. And I think it's all due to bladder incontinence. They don't want to be changing diapers 6 times a day.
Oh, that makes me so sad. That's very abusive, I'm sorry to say.
I mean, their basic statement to me was the doctor has to specifically prescribe a full glass for them to give a full glass with medication.
You know what? Most places, people are well taken care of, but the odd times when you hear stories like that, it just makes me very upset. The issues like that should actually be challenged. And, I don't know what facility you're talking about, but there's always an ombudsman. There's always rights. And if something isn't right, I mean, to think that someone isn't getting sufficient, we're supposed to drink 8 glasses of water a day to keep ourselves healthy and to keep ourselves hydrated, because elderly who are not hydrated can become even more confused. It's a side effect of that, And talking about keeping our bladders well functioning is not by limiting water, it's by drinking water and flushing out. So it's I really would suggest that a complaint be made. I know it's not easy, but it's not right.
All right, thank you. Thank you very much.
Thank you, Leonard. Anyone else have a question or a comment before we move forward? Christine says to be sure to clarify that if they are on dialysis, the fluids are limited. Right.
Very good point. Thank you for that. Must be a nurse.
She hasn't said that yet, but it sounds like it, or a doctor.
Or a doctor.
Right. I don't see anybody having their phone open right now, Lucy, so I say go forward.
Oh, she's a medical social worker. Welcome.
Ah, there we have it.
Okay, so let's talk about multiple medical conditions. Older adults often have multiple medical, not just yet. Did I skip one? Oh, yeah, next. I did. Okay. Side effects. Yes, thank you for that. You're on top of it. Thank you, Minerva. Okay, let's talk about side effects. Our adverse reaction to drugs that can be a symptom that develop due to taking medication. So believe it or not, many people become dizzy, which can cause falling. It's mental confusion, as I said, dehydration, not able to walk, a rapid heartbeat, palpitations, sweating, sleeping too much, not sleeping enough, not able, joint pains that you never had before. It could be diarrhea, it could be constipation, it could be vomiting. And I have to tell you that as soon as you're taking a new medication, if you notice any changes like that, it's extremely important to call the doctor and the pharmacist as soon as possible. And if the reaction is so bad, obviously, you need to go to the hospital. Now, again, let me just go back to talking about dehydration, because it's so important to be hydrated when you're old. I mean, when you're young as well, but when you're older, because the first reaction when you're dehydrated is confusion. So if someone isn't confused to begin with, if they are dehydrated, they might become. And for those who have any cognitive impairment, it's going to become even worse. All right, so are there any questions about side effects or any thoughts? Any experiences that any of you have had? Okay, so let's talk about multiple medical conditions. So older adults often have multiple medical conditions. You could be diabetic, you could have thyroid condition. This may affect how the medication works in the body. Medications used to treat one condition may also make another condition worse. For example, older adults with memory problems may have worsening symptoms caused by medicine used to treat their other condition. Therefore, it's important that all providers who prescribe medications for you know about all the medical conditions you have. Also, be sure to let the healthcare provider know if a medication they gave you worsens any of your conditions. So you see how many issues we have to deal with as we age, thinking that one medication for one condition, then there's another condition has an impact. I also want to talk about the effects of food and beverages and medication. Medication may be affected by food and supplements or medicine that you take at the same time. So for example, some antibiotics are not absorbed well when taken with foods, beverages, or medicine that contain calcium, magnesium, or iron, such as antacids, vitamins, or dairy products. Certain foods, such as grapefruit juice, can also change the metabolism of certain medications. This may cause the medicine to build up in the body, and so you really, really need to ask. I have to tell you, many times it's the pharmacist who knows more about the side effects than the doctor does. So before taking any new medication, please speak to the pharmacist. Now, we do get a sheet of information about the side effects. You should always read it. And if you're not sure, please talk about food and beverages. Very, very important. Now, I also want to talk about medication interaction. Okay. The bottom line is the more medication and other products you're on, the greater the chances of having medication interaction. So, I know it's almost like a juggling act. It's not easy. And that's why I'm saying how important information is. And I think that the guide provides a lot of the questions that you may have, or will illustrate to you situations that you should be aware of as a caregiver of what's actually going on. So, I just want to talk about a little bit about other factors, and then we'll open it up for a bit more discussion. For example, a medication effect can be affected by cigarette smoking, drinking caffeinated or alcohol beverages, if you've changed your diet for any reason, and obviously changes in medical conditions and viral infections. So you have to take into consideration that if someone has been smoking for a long time, and certain things are happening, I hope that you've told the doctor before they prescribe that medication that this person does smoke, whether it's a lot or not. It's still very important. Drinking caffeinated or alcohol beverages. Again, you really need to let the doctor know before prescribing how many cups of coffee the person is drinking or yourself. And obviously, alcohol is a major problem and a major issue. So if you're dealing with someone or yourself for that matter, who drinks a little bit too much than you should be, the latest research tells us that we should really only have 3 drinks a week, whereas before it was much more than that. So be honest, always be honest with your doctor. Let them know if alcohol is something that you do on a regular basis, because all you're doing, if you don't tell the truth, you may be, you're endangering yourself or your loved one. I'd like to open it for questions if people do have questions about alcohol, and we can talk a little bit more about it, or about food or anything else.
All right. We'd love to have a discussion at this point in time. So if you have a question or comment, an experience you'd like to share, that would be great. We'd love to hear from you. I also want to tell you, while you're thinking about questions that you may have, Gina had asked me in a direct message if I could talk about how to get the guide that Lucy keeps referring to. And that will be available to you. You will receive a follow-up email if you register for the session today. And in that email, there will be a question asking if you would like the guide, and also asking for your address, etc. So that is how you will be able to receive the guide that Lucy has been using on today's call, and also for there it is right there. And also she will be using that in the second session coming up on the 6th of October.
Thank you for that. This is something interesting that I found through the research. Let's talk about polypharmacy. Okay. Yeah, that was a new one for me. When older adults take 5 or more medications, it is called polypharmacy. With polypharmacy, the medicine may interact with each other and with your body in harmful ways. For example, the medication can increase negative side effects or decrease benefits. So it's not anything more than what I'm telling you now, but it actually has a name to it. And that was very interesting. Because if you go to the pharmacist, you could actually, if you're taking a lot, take 5 or more medications, you could tell the pharmacist, my loved one or myself is polypharmacy, and that it's really important to be very, very aware of that. So what happens next at this time? So, you're taking all these prescription, and then really what it boils down is that it's becoming, there's another word for it, prescribing cascade, okay? It's almost as if a prescribed cascade is when a side effect of one medicine is mistaken for a new medical condition, believe it or not. So you might have a side effect, you might not be vomiting, you might not be dizzy, but all of a sudden it looks like another medical condition. So what do? So then they go and give you another medication. So it's really so important. This could lead to being prescribed more medications than you need, and also further increase your risk of having more side effects and continuing the cascade. I think I saw something on the chat. Did I?
Oh, I was just adding in that if you hadn't registered for the call today or for the session today, you could still get a guide by calling our customer service representative. And one thing that I thought about as you were talking about that, Lucy, I think the biggest danger time for people in medications is when they've been in the hospital and they come back out. I know when I was with the Area Agency on Aging, we saved several people's lives because they were getting duplicate medications, different names, but the same medication, which could be, lethal.
Absolutely. And that's so interesting what you're saying, because next week I'm going to be talking about safe storage of medication. Discharge planning from hospital is huge. and knowing the generic names. Your pharmacist is your best friends.
Right.
You know, and so we will be going over that for sure.
Perfect.
Yes.
Charles, did you have a question or a comment? Charles?
No, I'm having trouble here. I'm sorry.
Okay,
No,
well, I'll
right.
mute your phone for you then. There you go. Okay.
Now, not enough for caregivers, not enough having to care for someone with difficult, you know, could be with cognitive impairment, physical impairment. Now I've brought into the fold a whole other area that you have to be more conscious of. But I have to tell you, as I said in the beginning, because I did say a lot of people really end up in hospital, in emergency rooms, seniors especially, because of medications, and it can really be avoided. So even though I've said a lot to you, all the under references, all what I've said today, you can read on your own as well. Can we go to the next slide? Because I'm going to talk about the guide. I'm looking at the time. Okay, perfect. Okay, so, you know, here's the guide again. What's interesting about it is about everything that I really talked about, except certain research, is in the guide. But on top of that, there are actual questions that are asked of the caregiver. You can answer yes, no, I don't know. And then they give you a tip of how to handle it. So even though the tips are very helpful, but it also really lets you know, it gives you an idea of what your family member might be going through. So one of the question is the prescription medicine from more than one pharmacy? Now, if you say yes, if yes, speak to the pharmacist to see if there are any problems taking all the medicine together. People who use more than one pharmacy have a higher chance of having problems between different medications. You know, you're getting some from here, some from there. You really should be using one pharmacy. Now, the second question is, does the person have any medicine samples from the doctor? If yes, talk to the pharmacist before the person tries them, even though the doctor told you to, you know, because they get lots of samples to make sure the sample will go well with other medicines the person is taking. Next slide, please. Now, that's how the guide goes. Example from the guide: has the person had any changes in comfort? So it kind of sensitizes you to all of a sudden, maybe the person you're caring for is showing more pain than before. It could be the medication, aches, headaches. Has the person had any changes in energy? They're more tired. They have more energy, you know? Has the person had any changes in sleeping? They can't stay away or they can't fall asleep. So you have a choice of saying yes. And if you say yes, then they'll give you an idea of how to deal with that. Next slide, please. So here we go again. Has the person had any changes in appearance? Now, let me tell you, our skin and our complexion, our eyes and our nails and our hair tells us a lot about what's going inside our bodies. So for example, if the complexion changes, it's pale, it's red, it's turning a little bitty yellowish, your eyes, the whites in the eyes have changed colors. Your nails, for example, if they're looking blue, there could be issues with airflow. If your hair is falling out, not normal hair fallout as we age, it's telling you that something is going on in the body. Also, appetite, eats more, doesn't want to eat, feels sick to the stomach, has dry mouth, is more thirsty. The behavior, mood, thoughts. If yes, any of these questions describe the specific change, tell the doctor and pharmacist right away. The problem may go away, or it may be a sign of a new problem. Next slide, please. Now, here are all the references that I told you about. There's a lot of them. There's another slide as well. Now you will be receiving all of this information. And I'm just looking at the time. I know that Glenda has some things she wants to share. So does anybody have any questions, any thoughts? And I hope that it's been of help to you. So love to hear from you.
Okay, now is the time that you can ask those questions. There's been a lot of information shared, Lucy. Thank you so much. So if it is brought up a question or a comment that you would like to make, please do so. And remember that part 2 will be coming up. What did I say? On October the 6th at
Yes.
10 o'clock
Yes.
Central Time. So it's important to listen to both sessions of this, because Lucy has different things that she's going to go over in that next session on the 6th.
For sure.
Well, while you're thinking about that, I was kind of reading messages over here, and there may be a session tomorrow of which I was unaware with Dr. Jamie Heisman. So I will check on that, and there will be something posted about that. But other than that, we have one more session in the month of September, which I just cannot believe, Lucy, that we are already at the end. And I know. And that session is Wednesday, September the 28th at 10 o'clock Central Time. And Lucy will be back with you again, along with Dr. Elliot Montgomery-Sklar, another of our frequent presenters. COVID is still with us. And so they're going to be talking about COVID-19, monkeypox, and flu, fall of 2022 caregiver updates. I think that's a really important session for all caregivers. I would encourage you to tune in. Again, that's Wednesday, September the 28th at 10 o'clock Central Time. And as Minerva said, our October calendar will be out in the next few days, so watch for that. No questions?
Okay.
Okay, Lucy.
All right. Well, thank you so much for joining me today. And I hope that I've been.
Wait, just a minute, Lucy. Yes. Akeem, he's back with us and he has a question.
Sure. Hi.
Yes, it's about one particular drug that I Googled, and it said in Google at the first warning, don't give this to people that has had a heart attack or elderly people. This lady is 89 years old, and I'm talking about, I got to pronounce that correctly, quetiapine, Quetiapine, and she got this in higher doses even, and I'm really concerned. I talked with some nurses about it that are in elder care and Alzheimer's, and that seems to be the drug of choice. So whom do I believe?
Well, since I said in the beginning, I'm not a doctor or a pharmacist. Remember I told you to look up the Reese. You could Google that. There's a whole list. As you said, you must have looked it up yourself. I would definitely speak to the pharmacist. Are you the one who's taking care of her medications of this lady?
Well, she is in a home already, and she gets it directly from the pharmacy, but I have a good contact with the pharmacist, so I have no problem checking with them.
Because you're kind of acting as an advocate for this person, and I really appreciate that. You know, it's so important to speak to the pharmacist, because just because they're giving it her, it doesn't mean that it's the right thing to do for her. I mean, again, I'm emphasizing people land up in most seniors, most elderly that land up in emergencies, unless they've had a heart attack or it's, diabetic coma or whatever. It's because of medications. It's because of side effects. So I would highly advise you to speak to the pharmacist. And if you feel comfortable to advocate on her behalf, then I commend you.
Thank you very much. I'll keep doing that. Thank you.
She's lucky to have someone there in her corner.
Isn't that the truth? Thank you, Akeem.
Thank
you for all you do. All right, Lucy, we have about 2 minutes, and I know we interrupted when you were having your final comments. So if you'd like to go ahead and do that.
Oh, no, I was just saying that I hope that thank you for the people who said that the information was helpful. I have to tell you, when I was caregiving for my mother. As I said, I'm not a nurse or in that field. I am a social worker, researcher. I really needed to know about medications. And so I'm glad to have shared this with you. Nothing stops you from looking at the references again. Keep your eye open. I think the guide would really, really be helpful because it kind of focuses you on what you need to look at. And when you do call the pharmacy, you can actually say this and this and this is happening. So I thank you very much. And I hope that you join me and Glenda on October the 6th. Stay well and thanks.
Thank you so much, everyone. As Lucy says, stay well, stay safe, and we will see you next time. Bye-bye.
Bye-bye.